Hi there, my name is Pete Zeman. I'm a urologist in Wilmington, North Carolina. Just wanted to make a few points about the Zida Sock that might help you guys when you approach other providers going forward or offices. But a couple things on my experience with it so far. I've been using it about 6 months. One thing, I guess, as a provider, the overactive bladder patients can be sort of difficult to treat. Sometimes they've tried a lot of different medicines and they haven't worked, and we're kind of come to the point where we don't have much more to offer. So I kind of find myself trying to avoid those conversations, and they're generally not interested in more invasive options a lot of the time. So the Zida Sock has sort of presented a nice alternative to sort of fit into that situation, and it's kind of made that conversation easier. It's actually an easy, quick conversation to have, and sort of something they can do at home, and pretty simple and straightforward. So I guess that conversation in the office as a provider is easier, so I don't find myself trying to avoid those patients. And so I think that's refreshing as a provider. The other thing is that once I send that prescription in, it's a straightforward process. It's pretty easy. I don't have to worry about doing any sort of authorizations or appeals or any of those things that providers don't like to do on the backside. So I think that's another definite plus. The Zida team sort of takes that over once that prescription's sent in. So I think those two things, I think from a provider perspective, make my life easier. And I think it's something that makes it more appealing to the providers that you guys talk to about it. I think it's a 2-minute conversation, and it just makes that process of seeing that patient easier. So I think that's, I guess, the things I wanted to mention. And I guess I'm not trying to run away from these patients. I'm actually sort of now have an option that I can offer them. And the Zida, and I've seen some of these patients back, and they're already starting to do well with it on some of these patients that I've seen back. So conversation's easier, makes my life easier, and then the patients are getting an option that actually helps them. So anyways, just wanted to sort of give you guys a couple perspectives when you see providers going forward. Thank you.